Again, I'm Katie Kuhn, and thank you for taking the time to join me today to go through some of these impacts of tourism, the effects of COVID on tourism, and some of the ways that regions are attempting to reapproach tourism in the post-COVID era. So to start off, we can take a look at the agenda for the day. We will begin with an introduction of who we are at REMI and what we do here. Then we'll get into a topic overview, look at a couple of case studies, discuss some potential impacts, and then look at a live model demo and go over some of the notable results and then draw conclusions from those results, and finally have time for a Q&A at the very end. So briefly, for those of us who are unfamiliar, we are Remy Regional Economic Models Incorporated, and we've been around for over 4 decades, working on government policy, providing top-of-the-line analysis, economic impact analysis to decision makers, and overall remaining driven by the single goal of improving public policies. Our representative clients, we have a few listed here just to give you an idea of the breadth and depth of work and of clients that we assist. So with that, it's nice to meet you. It's nice to be here on behalf of Remy, and I'll just go ahead and jump into the topic itself. So our guiding question for this webinar is, how are tourism-reliant regional economies approaching COVID-19 and the economic recovery from the pandemic? So really, thank you, Dee, and apologies to anybody with these technical difficulties. I hope it's not terribly widespread, but anyway, I guess we'll go on. So finding new sources of revenue and adjusting to the changing labor market, those are kind of the broadest new challenges for tourism-reliant regional economies looking at tourism post-COVID. 2 examples that we'll look at later today in our demos will be the state of Hawaii, which is an incredibly tourism-reliant economy. And it's an interesting case study in that it widely implemented COVID preventive measures. It also is a state that relies heavily on international tourism, particularly from Asia, and saw massive drops in international tourism as a result of the pandemic. And the nature of tourism in Hawaii tends to be as destination tourism, so a location that people from the mainland, people internationally fly to be tourists there. So it's much more of a destination, an international tourist site, and one that responded to COVID in pretty restrictive ways. Whereas South Carolina, our second example, is also a very tourism-reliant regional economy. In each of these states, we're looking at, well, in Hawaii, we're looking at 20% of the economy based on tourism and tourism-related industries. And in South Carolina, we're looking at around 10 to 15%. So heavily reliant on tourism. But in South Carolina, we saw fewer COVID measures or less, I guess, less strictly implemented preventative measures, and shifts towards automotive tourism from destination tourism. So, South Carolina being on the East Coast with surrounding states was more conducive to a shift to this automotive tourism rather than that destination tourism. So with those examples kind of in the back of our minds, we'll come back around to the specifics in Hawaii and South Carolina in a bit. But for now, I'd like to think more broadly about tourism challenges and these 4 key factors that determine regional COVID responses. So the first of these is mobility, driven by reduced income, preference for individual travel and accommodations, and the fear or restrictions of plane travel, especially internationally. Second factor here is governmental policies. So as I mentioned, for Hawaii and South Carolina, there were different local approaches to mandates, restrictions, different sort of levels of enforcement of the mask mandate, of social distancing, various levels of closure of businesses, bars, restaurants, etc. and for different lengths of time. And then federal funds also. So thinking about the money that came as relief to states and localities, and how that affected regional responses to COVID. Then thirdly, the labor market. I think it's probably something we're all well familiar with at this point, that COVID has been an incredible shock to the labor market in a lot of different ways, but particularly when we're talking about tourism, the unemployment spike in the services sector really hit hard for tourism industries, because those are primarily service occupations. Also, unemployment benefits, we saw increased unemployment benefits, and we'll talk a little bit about the potential effects of those. And then large shifts in labor supply and demand due to increased automation and computerization during the pandemic. And finally, the local regional industry mix is a factor determining this regional response to COVID. So thinking about regional variety of available industries, tourism as a percentage of a state's total economy, and thinking about the cascading effects of tourism upon other industries. So this graphic sort of shows us those 4 guiding factors that we'll dive into a little bit more deeply before we get to the specific case studies of Hawaii and South Carolina. So first of all, this mobility factor, as I mentioned, reduced income. In the pandemic, we saw a lot of people suffering job losses, suffering increased financial pressures, having to dip into savings, etc. So, traveling for pleasure, taking tourist trips became less of a priority. And we'll see on the next page a graphic that helps illustrate the socioeconomic impacts of these financial pressures and of these types of decisions. So these were not super evenly distributed across demographic groups, as we'll see shortly. So mobility was certainly affected by reduced income. Also, the preference for individual travel and accommodations. This actually it's pretty interesting. It affected how people made choices about their preferred modes of transportation. So, of course, as we're familiar with, people make choices on modes of transportation based on price, convenience, time of trip. But with the pandemic, one of the top factors for deciding on a mode of transportation was perceived infection risk. Then also, I think, as I mentioned earlier, the preference for automotive tourism and lodging away from crowds saw an increase. So being able to travel individually or within a family unit, traveling by car rather than plane or train, and lodging either in rentals like Airbnb or camping or things like that, rather than hotels. These were all shifts that we saw in terms of mobility during the pandemic. And then, of course, the fear and restrictions of plane travel and the international restrictions. So that caused disruptions in air travel, certainly created fear and uncertainty, thinking back to early in the spring of last year when US citizens traveling abroad faced delays and had trouble getting back into the country. So a lot of uncertainty around the risks of air travel, and then of course quarantine and testing requirements post-travel all worked to sort of help drive that shift away from plane travel to automotive travel and the more individualized approach to tourism and accommodations. Here we have a couple of illustrations that will give us a little bit more background on these mobility points that we just covered. So over here on the left from the Pew Research Center, we can see the financial pain points that most affected different groups during the coronavirus pandemic. So this is looking from a survey in August of 2020. And we're seeing that across these 3 groups, white, Black, Hispanic, and Asian, and then across these 4 racial groups and these 3 income groups, we see the harder hit groups being the Black, Hispanic, and lower income groups when it comes to questions of, what financial pain points they faced. So, thinking about tourism, thinking about the SEI impacts of tourism, it's pretty clear, pretty clear here that these groups were more disproportionately affected just on the level of making more difficult financial choices when it came to where to put their money. And then over here to the right, we can see this graphic from McKinsey, which shows us how this priority in choosing modes of transportation changed pre-COVID to during the height of COVID. So that risk of infection rose from being really not that important of a factor in making that choice to being the key factor in making that choice. Moving along, governmental policies also affected tourism in regional economies across the board. So mandates that require social distancing, mass temperature checks, etc. Restrictions on, events where crowds would gather, occupancy caps on restaurants, etc. All those very much hit tourism-driven economies' revenues and affected the tourism industry. Closures, of course, and then the federal funds, specifically thinking now about the American Rescue Plan. This is a key policy that is, helping drive discussions now about tourism and what the future will be of tourism post-COVID. So making decisions on how to spend that federal money in recovery. Labor market, of course, this was very important to the tourism industry. The employment shocks that we saw created downward shifts in labor demand, downward shift in labor supply, and this really created, the need for new equilibrium. Basically, everybody, all that was pre-pandemic, the labor supply, the labor demand, was really thrown out of whack in an economy like Hawaii or cities like Las Vegas, places that rely really heavily on tourism. They saw the utter unsettling of how things were pre-pandemic. As I mentioned, the unemployment spike in the service sector is pretty directly important to tourism, in that tourism is a primarily service-based industry. And again, we'll see this soon in the simulations, but the disproportionate socioeconomic impacts of these unemployment spikes in the services sector are really disproportionate relative to other sectors that we'll look at. And unemployment benefits, this was and continues to be a pretty important question when thinking about labor market changes during COVID. So asking the questions, have unemployment benefits put downward pressure on employment rates? And do unemployment benefits behave as a wage supplement / substitute? And then large shifts in labor supply and demand due to automation and computerization. We saw contactless services, which involved more computerized check-ins, check-outs of hotels, food service change, more delivery over dine-in, etc. So that increase in automation. Here we can see the increase in unemployment claims early on in the pandemic. It was most dramatic. And over here, we can see a survey from McKinsey looking at how executives made decisions about accelerating digitization and automation in their companies during the pandemic. So overall, we saw mostly an acceleration in that automation, and it does depend on the sector and the occupation, of course, but overall, because human-to-human contact is the transmitter of the virus, anything that could replace that, any technological resolution to reduce that was really, brought to the forefront, whereas, before people might have preferred a face-to-face interaction. And this final factor, the local regional industry mix. So this this greatly determines a region's how a region's tourism industry was affected by COVID, or is continuing to be affected. So core industries based on the movement of people, like tourism, hospitality, food service, etc., these face the highest unemployment because of COVID than core industries based on movement of information. And so overall, the regional industry concentrations were more resilient during COVID, experienced lower unemployment and concentrations in regions dependent on mobility. Hawaii being a pretty natural place to think of when we think about regions dependent on mobility for tourism. And then the cascading effects of tourism upon other industries. Of course, spillover effects resulting from economic shocks to a region's core industry. We see that the portion of employment in the hardest hit industries of COVID affected other industries in the region. So I guess another way to say that with a more concrete example would be in a locality where tourism sectors are the core industries, information related and other professional industries in those localities were also hit relatively harder than localities where the COVID resilient sector, like an information sector, tech sector, et cetera, was the core industry. So, you know, we're talking about tourism, we're focusing on tourism in this webinar, but those spillover effects really are not limited just to those tourism related sectors, even if that is where the brunt of the hit falls. So with that, we can move along and look at so I've mentioned this, but we'll get into a little bit more. So in Hawaii, the tourism sector comprises 21% of the state economy. And we saw that from pre-pandemic levels in 2019, tourism decreased, by 11.6% by July of this year. Tourist spending decreased by nearly 7% in July 2021 from 2019. The first 7 months of 2021, tourism was down 41.1%, and in the first 7 months of 2021, tourist spending was down 37.5%. And the domestic market, we're seeing some recovery happening. However, the international market remains pretty stringently restricted, and tourists from Japan are really a very big, important population contributing to tourism in Hawaii, and tourists from Japan remain down 98% essentially from 2019. So pretty striking number there. South Carolina, on the other hand, has some similarities, but also some key differences with Hawaii. The tourism sector comprises about 10 to 15% of the economy. And interestingly, South Carolina does have, again, as we mentioned, some other things to offer compared with Hawaii. For one, it's reachable by car, and there were fewer closures in the state. So golf courses that did not close down in South Carolina, they actually saw growth in revenues that were more dramatically increased than pre-COVID. Also, the state parks generated 13.5% more revenues than in 2019. So these two kind of interesting benefits. It's kind of strange to say benefits of COVID, but South Carolina did see growth from golf courses and state parks in terms of revenues, and we can see maybe some of those shifts in tourism to automotive tourism, to more local tourism, and more individual tourism may have contributed to the growth in these two areas. South Carolina hotels overall did relatively better than other hotels in other states across the country, but those numbers, were still pretty negative for South Carolina, pretty hard hit early in the pandemic. And we're still seeing some of those effects of this hit to tourism. It's still down by 15% at least from 2019 as of the spring of 2021. And we saw in South Carolina, the Parks, Rec, and Tourism Department estimated that domestic tourist spending was down 31% and international spending went down 80% in 2020. So just some stats, I think, to help give us a better picture of these two states and these two tourism reliant economies, to begin thinking about, the specific ways, the specific challenges these regions face, but also maybe some of the potential solutions and new ways of thinking about tourism that we might see going forward. So getting into a little bit more detail about Hawaii's tourism challenges, we saw unemployment and labor shortages. Currently, hotels have 30% fewer, or approximately 30% fewer available jobs than pre-pandemic. Unemployment, underemployment, and workers leaving the labor force all have hurt labor supply. There, of course, has been the argument that increased unemployment payments discouraged people from finding new work. Hawaii was a state that continued those expanded unemployment benefits, whereas South Carolina, a more conservative state, did choose to end those earlier. So one interesting part of comparing these two states is the fact that that neither really saw that increased benefit having the effect that some argued it would have. So after it ended, there was not an immediate jump in employment in Hawaii, and we'll get to South Carolina's impacts in a second, but South Carolina also did not see notable increases by refusing to continue that increased benefit. So that has been a political topic, certainly throughout the pandemic, thinking about these unemployment payments. And then finally, for Hawaii especially, retirements and workers leaving the island. This is pretty rampant during the pandemic. It's a high, the island has a very high cost of living, so that contributed as well to the unemployment and labor shortages, most specifically to the labor shortages that we're continuing to see in the state. International tourism, again, the outsized impacts of limited international travel, especially from Asia. Businesses that specifically cater to international tourists are not really able to see the benefits of recovery so long as international tourism is as far down as it currently is. So that's a more Hawaii-specific challenge, considering the reliance on Asia and international travel. And then automation and labor. Hawaii also as well as other regional economies, saw the effects and are continuing to see the effects of increased automation in terms of the hospitality industry, especially. So checking in and checking out via app, ordering food, receiving service digitally rather than in person. And as the economy has improved and as we've begun recovery, we're seeing that some of these jobs that were lost during the pandemic might not come back, since they can be replaced by automation. Hawaii specifically has some issues with hotel housekeeping and some labor disputes with the union for the hotel housekeepers down in the state. Hotel housekeeping was hard hit, of course, across the country, in that there were more restrictions on hotels letting or wanting housekeepers to come into people's rooms. They wanted to limit exposures, they wanted to reduce those room cleanings. However, that decreased the labor demand for housekeeping workers, and a lot of those jobs were lost. And now, even with some of those jobs returning, they are hard to fill. In that there's a distrust between, in Hawaii, there's some issues between the union and the hotels. And in other places as well, there are specific challenges to hotel housekeeping and other hospitality related occupations, either because of automation or because of other demands resulting from the pandemic shocks. Looking a little bit more into the tourism challenges in South Carolina, also seeing unemployment and labor shortages. In the state, the leisure and hospitality industries are still about 36,000 jobs behind pre-pandemic levels. Like in Hawaii, there is still difficulty finding hotel housekeeping staff to fill open jobs. Earlier in the pandemic, of course, those jobs were lost, and then even as they're being added back, it's been increasingly difficult. There are multiple reasons for that. One could be, earlier on with the childcare hindrances to workers while schools and daycare centers were closed. That certainly had some SEI impacts in that, women, lower income, and women of color in particular were hard hit by, the inability to send their children to childcare or to school during the day in order to work. And then, as I mentioned before, the conservative approach South Carolina took to the unemployment benefits did not result in meaningful gains in employment as a result. And the neighboring state to the north, North Carolina, kept the unemployment benefit for longer and saw better outcomes, not necessarily as a direct result, but more just to say that a clear interpretation of what the unemployment payments did to the labor market is still unclear and not quite as obvious as some political arguments might have it. Automotive tourism. South Carolina saw increases in tourism from residents within the state and from residents in neighboring states. State parks saw record visitation numbers as trips to parks were conducive to social distancing and individual accommodations. We did see that hard hit. We did see that hotels were hard hit as individual accommodations gained popularity. But overall, that shift from destination tourism to auto tourism and reduced air travel ended up being somewhat more to South Carolina's benefit. Automation also threatened and continues to threaten workers in South Carolina, particularly in that automation affects lower income jobs and jobs that require lower levels of educational attainment. And in the state, 68% of workers have a high school diploma or less. So the implications of automation in these industries, in food service and hospitality and leisure, and tourism, etc. The increase in automation has the potential to be pretty transformational to those sectors. And it's estimated that COVID accelerated automation, the expectations for increased automation by about 5 years. So, that demand for more streamlined technological procedures rather than face-to-face interactions certainly has some heavy implications for South Carolina, as well as Hawaii, as well as many other regional economies across the US. So with that, we can discuss some potential impacts. Here I included a list of some new approaches to reimagining the future of tourism. So many people have been writing articles and think pieces on this subject. How does tourism recover? What does it look like after COVID? There's a pretty big consensus that I think most of us would agree with, that the pandemic has reshaped our approach to many things. It's reshaped our approach to travel. It's reshaped our approach to tourism. And going forward, tourism may look very different and be motivated by very different things than it was before. So how can tourism reliant regions like Hawaii, South Carolina, and others respond and recover from pandemic shocks to the sector? And respond and recover, I think, is kind of key wording here. In that, thinking about the tourism sector's recovery, not just pre-pandemic levels, but by responding in new and creative ways. So several ideas for the future of tourism that I found in some research include the potential for ecotourism and sustainable travel practices, and overall tourism focused on social issues. So this might be a future approach to tourism. Interestingly, South Carolina is planning, or there's a large demand in the state for money from the American Rescue Plan to go towards shoring up the beaches, taking care of the beaches, and taking more of an environmental approach to a very tourism-heavy region of the state. And that might tie in with this potential for ecotourism and sustainable travel practice that maybe going forward, thinking about tourism and sustainability and environmental responsibility, those might be new motivators for tourism going forward. Reimagining the future of tourism may also require thinking about a lasting shift to automotive tourism over airplane trips. So as I mentioned, South Carolina, with that increase in automotive tourism, saw some gains during the COVID pandemic to the tourism industry, revenues increasing in the state parks and golf courses. So there might be some lingering effects of that on states where this is feasible, where automotive tourism is feasible. And I think too that the implications for a state like Hawaii, not quite as easy to shift to automotive tourism when you're an island, but that might have some implications for domestic travel to Hawaii going forward. And there might be some other motivators for tourism to Hawaii that'll play a larger role post-COVID. Another way to think about the future of tourism is taking what we've learned from the COVID pandemic in terms of transparency and data availability and accessibility, and think about streamlining digital access to data relating to tourism, health, and safety while traveling, increasing that government transparency, and continuing, even post-pandemic, to assuage concerns about traveling, about safety, about health risks post-pandemic, by taking this approach to digitizing that data and making it more accessible. Another way that tourism could change in the future would be building tourism hubs that connect public and private sectors in a region. I think this ties in pretty closely with this suggestion about streamlining the digital access to data relating to tourism and safety while traveling, and that a tourism hub that focuses on, encouraging the private sector and the public sector from a tourism perspective can also be a new approach going forward. And then finally, creative government policy approaches to ensure growth and broad-based prosperity are necessary to, first of all, bring these economies back to full recovery, to be able to accommodate the ongoing threat of variants to the virus. Pandemic is not over, and of course these threats continue to evolve, and new approaches to tourism, new ways to be resilient in tourism-related industries are ongoing and still requiring creative government policy responses. So I think a fair conclusion from this is that the pandemic may reshape approaches to tourism in long-lasting ways. And with that, I think it is a good time to move over to our live simulations and look at some results in the states of South Carolina and Hawaii. I'll be performing these simulations in Remy PI Plus, our flagship model, which generates realistic year-by-year estimates of the total local, state, and national effects of any specific policy initiative. The models that I'll be using today are also socioeconomic indicator enabled, so they include a suite of features that will help us analyze and understand the differential socioeconomic impacts of tourism spending on the region. The two models I'll be using, first will be a Hawaii model for region, so each county, 70 sector PI plus model with socioeconomic indicators enabled. We'll look at the tourism spending variable in both models, but here we'll take a baseline assumption of $18 billion in tourism spending in normal years based on 2019 numbers. I I'll go ahead and turn it over to the model itself so that we can see this in action. The South Carolina model that I will use is a 46 region, so full county state model, 70 sector, PI plus, also with SEI enabled. With that, I'll pull up the models. So here is our Hawaii model. If you've never seen a REMI demonstration before, I'll briefly introduce this, this landing page. So when you open up a REMI model, this is the user-friendly tiled interface you first come to. Down here, the regional forecast and the national forecast. You can click on these boxes to see the baseline forecast for the nation and the region. These are created from University of Michigan RSQE data, CBO data, etc. Something we would be more than happy to get into in greater detail, following the webinar. But here you can set new controls, which here I've done with the tourism spending, to set the sort of expected tourism spending in a normal year versus the COVID years. And then I ran a new regional simulation. So that's how this user-friendly tiled interface works. And with that, I'll show you the simulation that I prepared. So first of all, here is our policy variable selection page. And if you go to tourism, if you go to scenarios, you'll see that we have a tourism module built in, which connects you to this tourism spending scenario, which I'm just showing you here so you see that capability and ease of use, but I have prepped the simulation. So I'll take us over to our inputs and show the tourism spending for non-residents in the state. Here I'm looking at Honolulu County, but using state numbers approximated from data online. So I have the major drop in tourism spending from non-residents occurring in 2020, continuing on into 2021, evening out by 2022, and then over the next few years, beginning an increase back to normal. And with that, we can click over to these results and take a look at how COVID affected tourism in Hawaii, and how that effect on tourism impacted the state as a whole. So with this economic summary table, we can see an overall loss in employment, as we would expect to see during the height of the pandemic. And then this year, which of course there's still some variables up in the air here, thinking about variations of COVID and the threats that those are presenting and how that might change behavior, consumer behavior. But using the numbers that I estimated and put into the inputs, you see still loss in employment, but slightly lesser on through 2022, where we then begin to see the slow recovery of employment through 2025. We can see a loss in population, pretty steady over all 5 years of the simulation. Loss in the labor force, getting less and less dramatic over time, but still remaining negative. GDP decreasing initially and then slowly beginning to recover, as well as with output and personal income. So we can see that of course the losses from the height of the pandemic are going to take years to recover from, and also have implications for population of the state and the labor force of the state. So with that, I'd like to take a little bit longer to, or I'd like to take a little bit of a closer look at the socioeconomic indicators as a result of the change in tourism in Hawaii, thinking about how it was hit during COVID and how it may recover. First, we can see the compensation distribution, which helps us understand which industries were hardest hit by the pandemic during the height of it, and which industries are going to sort of see the beginnings of recovery first. So these industries are broken up into quintiles based on their average annual compensation rate. We see initially some large hits to the fourth 20%, as well as to the second 20% of industries. In 2021, we see that continuing on with greater losses to the fourth 20% and to the second 20%. And then over time, we see that the first quintile to recover most dramatically is the fourth quintile here, when that tourism spending begins to resume. We see small increases also for the lowest 20% and the highest 20%, interestingly. So tourism spending really is affecting both the high and the low end of the income distribution. We can see compensation rate weighted by baseline employment. And then we can also look at the inequality coefficient. Excuse me, I might have to reopen my tab. Let's see. Okay, there we go. I'd like to show you the inequality coefficient, but I think I'd have to close it down and reopen it. So with that, we'll look at employment by income level. So this is employment broken up by industry quintile. So we can see the largest losses in employment first, the second 20%, and the fourth 20%. And later on, we can see the beginning recovery going most to the second 20% and the middle, excuse me, to the fourth 20%. So a way to maybe interpret this, there's a lot of things going on across industries, but considering a jump in tourism spending, we can see that these are affecting the industries, tourism-related industries, which are falling into the second 20% and the fourth 20%, which is why they're both being affected the most, and being affected the most by the loss of spending, the loss of tourism, as well as benefiting more from the return of tourism spending. We can also see by occupation quintile how employment's changing. So with that, I'd like to take a look at employment by demographics. I think this will present some interesting results, thinking about socioeconomic impacts of tourism, or of COVID's effects on tourism. So we can see that overall in Hawaii, the largest group that lost employment was the other non-Hispanic group. So considering the very large Asian American and Pacific Islander population in the state, it makes sense, and also the proportion of AAPI people in tourism-related industries, the losses of tourism really greatly impacted employment for this racial and ethnic group, which I think helps reveal the necessity of a policy response that accommodates or that specifically addresses the struggles of a group that is harder hit by the pandemic in a particular sector. We also see the Hispanic group being hit relatively hard, especially considering the proportion of Hispanic people in the state and in the industries of interest. And we also see losses for the white non-Hispanic group too, although not nearly as pronounced as for the other non-Hispanic group. Next, we can look at employment by education. So this shows us employment by educational attainment. The summary chart shows us the number of jobs created, or in this case, the number of jobs lost, based on whether or not the occupation requires a bachelor's degree. So we see that the outsized share of job losses is hitting those without a bachelor's degree, although there is a pretty significant impact on those with a bachelor's degree. Labor force participation, this looks fairly similar to the employment by demographics piece. And we see overall decreases in labor force participation across our time horizon, most pronounced for the white non-Hispanic group and for the other non-Hispanic group, likely for reasons that we mentioned before, in that where tourism spending is reduced, the industries most affected are proportionally more made up of other non-Hispanic workers. So in Hawaii, likely AAPI communities. The last two pieces we'll look at for Hawaii are the unemployment rate and per capita income. So altogether, large increases in unemployment up until we see the beginning of the recovery. And we see this across counties, although again, here I had focused on Honolulu County in my inputs. And finally, per capita income, we see decreases pretty dramatically in the first 2 years of the pandemic, and then slight increases showing up in the recovery over time. Very briefly, I'll go over some of these results for South Carolina. Briefly, we can see the economic summary and the loss of total employment, and then this sort of slow recovery coming after. And then we can look at our socioeconomic indicators and get an idea of how this state was affected differently by similar changes in tourism spending. So here, the compensation rate by industry quintile, we see that the lowest 20% is hit the hardest. So tourism spending in South Carolina is more directly impacting the lowest 20% earning industries. We can see employment by income level. So by industry quintile, again, we see how hard hit the lowest 20% is. And also the second 20%. But in essence, in South Carolina, these lower quintiles are where that tourism spending is most effective. Employment by demographics, interestingly, we can see larger losses for the white non-Hispanic group. I'll show us this in percent change. So we see the largest losses for the white non-Hispanic group and the Hispanic group, as well as losses across the distribution, but most notably for these two. And then the recovery, again, somewhat more significant for the white non-Hispanic and the Hispanic group. So proportionally, thinking about the makeup of the industries, the tourism-related industries that are being affected by changes in tourism spending, the two demographic groups most affected are white non-Hispanic and Hispanic people. And interestingly, we can see by gender too, how male and female groups were differently impacted by that change in tourism spending. Similar to Hawaii, we see that in employment by education, a harder hit results, or the results show a harder hit group being the workers without a bachelor's degree, although we also see the losses for those with a bachelor's degree. Labor force participation, we can observe a greater decrease in participation initially for the white non-Hispanic and the other non-Hispanic group. And then again, the higher recoveries for these groups. Overall, unemployment increases across all counties up until the recovery begins, where we see slight recovery, slight decreases in the unemployment rate. And finally, per capita income, we can see how personal income per capita was affected by tourism spending across our regions of interest. So we can also look at county by county results for this. But overall, dramatic hit in the early years of the pandemic and slow recovery. So back to our presentation, and we can conclude relatively quickly. I'm bumping up on my time here. So our conclusions for reimagining tourism post-COVID, the 4 factors most determinate of a regional economy's response to COVID was mobility, government policy, labor market, and regional industry mix. So we saw that reimagining tourism post-COVID might involve a greater focus on individual or smaller group travel and automotive travel. We may see a continued reduction in business conference travel as events shift more permanently to online platforms. And we may continue to see that emphasis on health and safety risks when choosing modes of transportation. So when thinking about ways to increase that tourism spending variable that we just saw in the demos, these are the factors that decision makers can take into account when they're planning long term for bringing tourism, re-strengthening tourism, and bringing that money back into their region. Government policies, of course, in the near term, government funds are still very much needed to help these economies hit very hard by COVID be able to recover and prepare for future success. Of course, there are upcoming challenges still on the horizon, thinking about COVID variations, variants, and the risk brought on by those. And then, as we saw too in those socioeconomic indicator results, SEI implications suggest that government policy responses should also keep these socioeconomic indicators in mind, and where appropriate, where appropriate, make policy that specifically addresses challenges that are more disproportionately hitting one group than the other. As far as labor market challenges go, there could be an entire other webinar just on this, and there have been. But the unemployment and labor shortages persist long-term in tourism-driven regional economies. Automation remains a problem, increased by the pandemic, accelerated by the pandemic, and the SEI implications exacerbated by the pandemic, especially in these hard-hit service industries, are revealing some problems that regional workforce development programs and goals can in the future plan ahead for and think about shifting demand for these skills. And finally, the regional industry mix, we saw those interesting spillover effects depending on the core industries in a region. And so we're seeing, we saw that the tourism-based regions where tourism-related industries were the core industries also resulted in worse effects on the not so directly tourism-reliant industries in the region. So the conclusion from that would be that global crisis like a pandemic requires not just a global approach, but also a local approach with a regional perspective on economic challenges and industry responses to economic shocks, which is really where Remy steps in and where our models can be useful in understanding those local impacts, that specific local industry mix, and how a particular regional population, regional labor force, regional economy overall is affected by an economic shock, and how you can plan ahead for post-COVID or for future economic shocks that we haven't even anticipated yet.